and then Tyler, Soroy. This is your district here, right? Or which?
Sir.
Oh, it's yours. So you're north of here?
Yes, sir.
Okay. You have everything in Brevard, right? Yep. Good. So thank you all for being here. We're really excited today to be able to announce the opening of this vaccine site, and it's going to be dedicated to providing the one-dose Johnson & Johnson vaccine for seniors here in Brevard County. So they're going to do 1,000 seniors a day for the next 4 days, and we think that that's something that's very, very exciting. The response of the Johnson & Johnson has been very positive. As you remember, what do we got there? Oh, wow.
You should just start from the top.
Yeah.
Yeah.
You want to do that photo real quick? As we were saying, we have 1,000 shots a day with the Johnson & Johnson vaccine for seniors for here in Brevard County. I want to thank everyone for working hard to do this. So this will be 4,000 J&J shots over the next 4 days. And this is something that you're one and done. You get it, and then you can kind of move on. Now, obviously, it takes some time for the potency to be 100%. But this is something that I think a lot of people have really been excited about. There was some confusion at first because they said, oh, it's not as, quote, effective as Pfizer or Moderna. Well, it was 100% effective at preventing death and significant illness and hospitalization, which is really the name of the game. So technically less, quote, less effective at preventing mild infection. But honestly, you get a mild infection, we deal with those all the time in different types of viruses. So this really does the trick, I think, and I think it's going to be really, really good. And part of the reason why we wanted to work with J&J, Brevard, we've done almost 80,000 shots for 80,000 seniors have gotten shots in Brevard, just under that. 53% of seniors as of this morning's report. Obviously, the report does lag, so it's probably more than that. But you look statewide, we're way over 60% statewide. So we really believe this site here can help get Brevard with 60+% of the seniors having shots. I think that that's very good. When you're doing J&J, you do a site like this, you don't got to come back in 21 or 28 days. All of our other sites we've done, you got to come back. Now that we're using J&J, it's going to be really, really good. So we think this will be very positive. I mean, you look around the state, so we definitely will do, or probably have already done, 3 million seniors. The reporting is a little, I think it's like almost 2.9 million, but as you know, these reports are not put in real time. So we want them 24 hours, but in reality, it takes days and days. You go back and look at last week, the number of shots that were being done was fantastic. This week is same. So we've almost assuredly done 3 million seniors. That'll be reported very soon. And we're in the 60%, so over 60% of seniors. But I think we're going to be able to get 2/3 of seniors reported relatively soon. I think what we found in other counties is once you get over that 70% mark of seniors that have gotten shots, starts to slow down a little bit. And I think it's because there's no mandate on vaccine. You want it, we want you to have it, especially if you're 65 and up. You don't, that's fine. But once you get over the 70, I mean, we have Lafayette, which is a rural county, 81% of seniors have gotten shots. St. Johns County, 79%. But if you look back a week or two ago, St. John's was in the 70s already. So the demand does go down. Nassau, 74%. Leon, 74% of seniors. Indian River, just south of here, 74% of seniors. Palm Beach County, 70% of seniors have gotten shots. There's a massive senior population there. We've done over a 250,000 seniors just in Palm Beach County. We're doing more. Lake County, 67% of seniors. Alachua, 69%. Broward, really big county, 67% of seniors. So we've had a lot of success, and as I said, Brevard's done well, but we want to be able to get those numbers from the mid-50s up until the 60s. So I think this is something that'll be really good. If you look at what's happening on the ground, we did seniors first. We were the first state to do seniors first. We were the first state to do nursing home residents. We were ready to go on day one on that. We were the first ones to do seniors in the community. And obviously, we got a lot of seniors we got to get through in Florida. It's a massive state. You have seniors all over the state. It isn't like they're all in one part of the state. We have seniors all over. So we've done that. And the 7-day case average for seniors 65 and up, the rolling 7-day average, is down 84% from January 6th to March 8th among seniors. Is that the vaccine starting to help out? You know, maybe. We don't know. Rolling 7-day hospitalization average of seniors is down 79% from February 3rd to March 8th. That's a huge, huge decline. And then Florida continues to rank 41st. 40 states have higher per capita mortality for COVID seniors for COVID than the state of Florida. So that's really the name of the game there. Are you protecting seniors? And so we're in a situation here where Brevard, as I mentioned, is in the mid-50s for senior coverage. We think this is going to be able to get them even higher. Our retail pharmacy footprint continues to expand. We initially started with Publix. We were able to expand to Walmart and Winn-Dixie and Walgreens and CVS, and those continue to expand. It's a very good option for a lot of people, and particularly as we look to expand on Monday to below 65. We're going to do 60 and up, and we're going to go below that very soon too, and I'll have an announcement on that hopefully next week. But we right now have 97 Walgreens offering vaccine, 730 Publixes, 157 CVS, 119 Walmart and Sam's Club, and 43 Winn-Dixies. In Brevard, we have 22 Publix offering vaccines, 6 Walmart offering vaccines, 1 Sam's Club, and 2 Winn-Dixie. Now, Publix had reservations this morning. I'd imagine those are probably filled by now, but Monday morning I know they'll have another window, and it's publix.com/COVID vaccine. Walmart is walmart.com/COVID vaccine. Sam's Club is samsclub.com/COVID. And then Winn-Dixie is winn-dixie.com/pharmacy/COVID-vaccine. And even though they're not in Brevard yet, CVS and Walgreens, cvs.com, walgreens.com, for those appointments, very easy to do at this point. And we anticipate, particularly CVS and Walgreens, the footprint on those growing dramatically, hopefully in the next several weeks. That'll make it really, really simple, I think, for a lot of people when we start to expand it below age, say, 55. People will be able to go in and do it. It's really good for people 55 to 65 as well. So I want to thank the legislators. I know they're working hard. We've got a lot of important priorities. We're working on holding big tech accountable for deplatforming and censoring people, also protecting Floridians' data privacy from big tech. It's just very, very important. The House has passed really strong anti-rioting legislation. We want to continue with that in the Senate and get that over the hump. I think we're going to do really well with our key initiatives in terms of environment, in terms of education, and we're going to have some announcements on education next week. And if you look, we were treated very poorly in the stimulus. The states that got money, if you had higher unemployment, you got a windfall. In states like Florida, our unemployment rate's now 4.9%. The states like California, they're 9%, 9.1. New York's 8% plus, these states. And, they locked down. It wasn't effective. They have higher COVID mortality. Certainly New York and New Jersey and Illinois and all those. California has much higher per capita for 65 and up than we do. And yet you have all these economic problems and schools are closed in a lot of those places. So Florida, we're going to end up getting about $2 billion less than if they had just done a per capita distribution. And that's really fundamentally unfair. We actually had to make tough decisions. We really followed the data and made the right decisions about keeping kids in school, keeping the economy going, all these things that we've done. Seniors first on vaccine, and then for them to turn around and take billions of dollars from Florida and send it to these other states, that's not the way to do it. So we're very disappointed that the Congress decided to do that. And then finally, Biden last night said that they may have to impose more lockdown type policies in the future. I can tell you that ain't happening in Florida. We are not going to let him lock down Florida. I know they talked about restricting travel of Floridians. That's totally unacceptable. We said that from the beginning. But with vaccines now available, with the vast majority of seniors, 60+% of seniors in Florida, we're going to hit 2/3 of seniors very soon. Hopefully we can get it over 70% if the demand's there. And then getting vaccine into the 60 and the 55, which we'll do very shortly, to even contemplate doing any type of lockdown, honestly, it's insane. And so that's not going to happen in the state of Florida. We like the fact that people are able to work here. We like the fact that we've been able to save thousands of businesses and save people's livelihoods. And we love the fact that parents have the right to send their kid to school in person. So we're going to continue doing what works, but under no circumstances would we entertain anything of the sort. And so I think these vaccines are great. J&J is great. I think the seniors are going to love it here. And we look forward on Monday in Brevard, as well as throughout the rest of Florida, for getting our 60 to 64-year-olds in the hopper. I've already talked to a lot of them that have their appointments, and they're really excited about it. I think we could get through a lot of them in relatively short period of time because the supply is better than it was a month or two ago, and then hopefully be able to go into even younger demographics, particularly the 55. So stay tuned on that announcement. But I want to thank everyone for making this site happen, and I think it's going to be really successful. And we're going to do, we did one in Sumter with the J&J. We've done one in, I was in Lake City up in North Florida yesterday with J&J. We're here. We're going to do another one on the east coast of Florida later today. And then as J&J starts becoming more prevalent, we didn't get any new J&J this week. So this is that initial dose. The pharmacies have some. We have some at some of the normal sites. But we wanted to say, let's do some specific J&J sites and see how the demand is. And I think the demand's been really, really positive. So we're excited about that, and we want to keep up the momentum going forward. With that, I take a question. Yes, ma'am. Well, so I think a couple things. One is we're going to do 60 plus starting on Monday. We think that that'll go well. The infrastructure that's in place now is fantastic. At the end of December, when we were doing Seniors First, we didn't have any retail pharmacies. There was no retail pharmacies that you could get it for at all. We were doing it primarily through hospitals, started to expand it to county health departments. Hospitals did a really good job, but I mean, they just weren't used to having hundreds of thousands of people crash on their system. Some of the counties weren't ready for that. We've obviously helped augment that with some state support for there. So I just think we're in a much different situation than we were there. But that's why we're doing the age gradually, because the 60 to 64, that's between 1.5 million and 1.9 million additional Floridians. Now, not all of them will want it, but a big chunk of those are going to want it. So you want to go through, do it. We have much more doses on a weekly basis than we did 2 months ago. Then you do the 55, and you get the sense of that. And then I'm pretty sure sometime in April, as long as the supply keeps coming in good and hopefully increases with J&J, then you'll be able to do it and say, you know what, any adult who wants it can get it. I'd be willing to bet you that the interest in it from people that are, say, under the age of 40 will be much less than it was with the seniors. I mean, we had seniors that were waiting for this vaccine for a long time. This is a big deal. I mean, I've gone to so many of these places where we've been able to bring vaccines to seniors, and it's a very emotional experience for a lot of them. I mean, because they've been waiting for this, so finally get that shot. You know, they feel like that it just gives them that confidence to really be able to live full lives again. And I know a lot of seniors have been doing a lot of good stuff in Florida. They haven't necessarily been just sitting at home all the time, but they've been cautious, and now to have that. So it's a really, really big deal. I think as you get into some of the younger demographics where the risk is just a lot lower, I think it's going to be less than 50% are going to opt for it. And in fact, we got a little bit of a preview on that. When we brought it to the hospitals, we did the frontline healthcare professionals. You know, so a lot of the nurses chose not to do it, particularly the younger nurses. That was their choice. And so I think you're going to see something similar. I think you'll see a majority of people 55 and up will ultimately want it, but I think below, say 45 or 40, I think it'll be less than a majority will ultimately want it. But here's the thing, if we want to increase the vaccination rates, you can't tell people that you got to wear masks for the rest of your life. You got to tell them get the vaccine so you can live normal. And I think some of the messaging has just been so destructive to try to get people to want to do it. Why would they want to do it if there's no benefit for them? And when they say that, oh, you may be able to have a couple family members over for July 4th, I mean, what? We've been doing that for over a year in Florida. I don't understand kind of some of this messaging. So I think we're going to be in good shape as long as the vaccine continues to come, as long as we get the anticipated increases. We've got a tremendous infrastructure. I mean, I mentioned the pharmacies. We have 730 Publix, I think, that have it now. CVS, we've expanded, but we could do a lot more with CVS. And so as the doses come in, boy, I think there's over 1,000 CVSs in Florida. So just imagine that in all these communities. It'll be very easy for a lot of people to get shots. So we're excited about it.
Some states have waiting lists. Some states have a central website where everybody can go and get their name on the list, even if they're not eligible yet. Is that something Florida can do?
So what we've done, we try to work it. So the state isn't the one that is, you know, we have different ways of doing it. And so ours is a more decentralized approach befitting a really big state, very diverse communities. And so what we have is obviously the hospitals were the first game in town. We have the county health departments. Some of them have done waiting lists. We have the retail pharmacies, which are really expanded, but that is not signed up on a government list and then transferred. You got to sign up on that directly, and that makes sense because you certainly don't want the government involved in that. We've done a number of events with church groups. We've done a lot of African American churches. We rely on the churches to reach out to their parishioners and bring folks in, and it's more effective that way. So again, that's not taking them off a government list. That's working with the community and saying, who do you want us to vaccinate? We'll do it. Same with the senior 55 and up communities. You know, when we're down in Kings Point and Delray Beach, we're working with them to notify their folks, roster them, and then do it. So it makes it easier for different folks. And then we also are now getting it in physicians' offices, and then we're getting it in some of the health plans now have this. So a health plan is great because they have people that they service on a normal basis. So say Monday, we have 60 plus. A health plan can reach out to some of their members and say, okay, you want to come in and get the vaccine, you do it. So it's a very orderly process, and I think it works very, very well. So that, I think, is better than trying to have it all centralized in the government and have the government be the one that is dictating all these appointments. Because the fact of the matter is, a CVS or a Publix or a hospital or some of these people, they do it better than the government does it, and we want to leverage the existing resources. So we made that decision from early on. I think if you're a different state, if you're a very small state with, instead of having 22 million people, if you have 1 million people, you may be able to do it a little bit differently. But for our situation, with the big senior population, with the seniors really spread out all over the state, massive geography differences, we feel that this has been the most effective. And look, I think the results speak for themselves. We've done millions of seniors. We're either number one or close to the top of the percentage of all vaccines that have gone to seniors, the total number of seniors vaccinated, and then the percentage of all seniors that have been vaccinated. And so it's taken, I think, a real multifaceted effort, and we're going to continue to do it. And as the 60 plus get in, we're looking forward to a lot of those folks being able to get the vaccine. I think you'll see hundreds of thousands of them over the next week that are going to be eligible will likely be able to get it. We're also going to be making sure that if there are some of those very elderly people where we have a new way for them to contact us for the homebound program, we're very attentive to that because we understand that's going to continue to be an issue because not everyone has necessarily the internet or can do the phone calls or any of these other things. So if there's someone homebound, and we've done Holocaust survivors, we've done World War II veterans, we've done a lot of these really special people, and we want to continue to be able to do it. But I think next week we will have a good sense as we see the demand, when we can maybe even lower that age even more. We'd like to make that decision next week sometime. I'm not saying it's going to happen effective next week, but I'd like to be able to make that announcement by the end of next week, get it down to 55. And I'm pretty sure by the time March is up, we will have all 55 and up, no questions asked. And then surely some point in April, depending on demand, I think it'll be open to all adults who want it. And so that's exciting. And I think that's, if we were here a year ago, remember they were saying vaccines take years to do. No one, all these guys, all these experts were saying you couldn't do it, it wouldn't happen. We're in a position where we may have 2/3 of our seniors done, like on basically a year after the whole pandemic was declared. That's pretty incredible. I think it's a testament to America and a lot of the ingenuity that we saw with Operation Warp Speed. Okay, very good. Want to do some photos or whatever? Okay, where are we gonna go? Yeah. Can you put that in the car? Yep. Okay. Hi guys. How are you? How are you?
Shaking something, I know.
How you doing? Good to see you. Good to see you. How's life treating you? Family doing well? Yeah, good. Can't complain. I appreciate your help with all that. Mr. Price, Eric Rogers.
Oh, how are you? Good to see you. See, I knew you'd find out about it eventually.
Put it on the mask, and when you wear it, it's just Hey, Debbie, how are you? On the road today? Up there. Yeah. Safe travels. Yep. Sweet, yeah.
No problem.
Right here?
Got it? All right, hey, thanks. Are they going to do some this in the Senate?
I mean, even part it's running through the process. I don't know why.
Safe travels. Safe travels.
Can you take a moment of your time, sir? Yeah, of course, of course.